Hello and welcome to the EduTalk series hosted by Biotone EduPartner School Program, and massage industry experts. With the continued interest and popularity of the EduTalk series, Biotone continues to support virtual learning and building massage community by connecting you with industry experts who share their knowledge and expertise on topics not only for class discussion, but career success. Today's expert is Dr. Susan Salvo, a practicing massage therapist for over 40 years. Susan's an educator, an industry presenter, and an author of two textbooks, Massage Therapy, Pathology for Massage Professionals, and Massage Therapy Principles and Practice, plus numerous industry articles. She reviews case reports for the Massage Therapy Foundation and has participated in the Massage Therapy Body of Knowledge Project and Council of State Governments Interstate Compact. Additionally, I guess in your spare time, she works on her blog, which is Susan Salvo's Massage Passport, Massage Practitioner's Guide to Pathology, Special Populations, Self-Care, and Improved Professional Practice. Let's listen and learn as Susan discusses upgrades for C-section recovery, postpartum depression, and infant massage, designed to help therapists, doulas, and healthcare providers expand their skills to support new mothers and infants through massage therapy. She'll share techniques for providing safe and effective massage in three key areas: labor and delivery, postpartum depression, and infant massage. At the end of Susan's presentation, and feel free to chat questions and comments that she'll answer following her presentation. Once we get through the chats, she'll also ask some questions of the audience, and you are welcome to unmute yourselves to participate with that. All right, I think we've got it. Thank you, everyone. And Susan, thank you so much for joining us again. Susan did present a part one to tonight's EduTalk, March 4th, 2025, and she'll remind you of that in a minute. So Susan, it's all yours. I'll see you when it's time for chats.
Thank
Thanks.
you. I appreciate you being here with me today. And thank you, Biotone, for sponsoring this incredibly important event and has been doing so since during COVID. So what I'm going to do first is I'm going to share my screen. And I'm going to share screen and pop it up right here. Share. Okay, can you see my screen right now?
Yes.
Okay, right. So this is what you were talking about a second ago with the class that we did back in March. So we talked a little bit about pregnancy massage updates, and I'm going to remind you about 4 things that we discussed during that presentation before we dive into the new content, because I think it's a really good summary. And this is for today. This is the presentation for today. So you are doing the introduction. These are the 2 textbooks that I have written. Both of these are actually in their newest editions. Those will be coming out 2026. So be on the lookout for those. Okay, so the very first thing I want to mention from the last EduTalk was that denying services to pregnant women or women in the postpartum period or lactating women can be considered unlawful, discriminatory, and unethical. Why? It's because it undermines the client's right to choose their own healthcare choices, and massage is considered a healthcare. And it also violates the client's autonomy and civil rights. So again, I know it's and we don't see this as much anymore as we used to, but not a lot, but several businesses are still denying massage services to first trimester clients. Hopefully by the end of 2026, that will be completely dispelled. That'll be history, as we say. The second thing is preeclampsia. This has been something we're talking about now. And so massage is indicated, specifically foot massage is indicated for preeclampsia. Preeclampsia, one of the key things in preeclampsia is a hypertension or high blood pressure. And we know that massage reduces that. So it is actually indicated for clients with preeclampsia. The other healthcare practice that has had a change over the last few years is the degree of tilt that we are putting a supine lying client in, again, still semi-reclining after 22 weeks of pregnancy or earlier if the client's already showing. So what does that mean? That means putting a cushion under the right hip to tilt her body to the left. And what this picture shows you is that you can see the compression of the blood vessels between the pregnant uterus and the spine, the lumbar spine, which is taken off of that pressure whenever you tilt the client to the left. We used to say back in the 70s when this started in medical practice, we used to say a 15-degree tilt. New research has come out and we changed that to a 30-degree tilt. And the last thing before we get to the new content is that all essential oils are considered safe, topically applied. A research study came out in 2021, and this is supported by Jane Buckle of 2014. And they said that there's no evidence that essential oils applied topically in aromatherapy amounts during pregnancy or abortifacient. That means can cause abortion or has any kind of adverse effects. The researchers in this study said that all essential oils can be toxic at high doses, and that skin irritation was the most commonly reported side effect. And that, again, the authors advise screening all clients for skin conditions and allergies before applying essential oils, not just pregnant clients. So that's going to kind of be the segue between the March class and the class that we're doing today, which I've been told is the last EduTalk of the year. So a little bit about childbirth. This is where we're going to be headed. So about childbirth, there are two main broad classifications of childbirth. One is going to be a vaginal childbirth. The other is going to be cesarean or C-section childbirth. And these are the new stats for United States. About 67.7 live births in the United States were considered vaginal, and 32.3% were considered cesarean. And of that 32.3%, about 15% were considered VBAC. And VBAC is vaginal birth after a C-section. So we're going to be focusing on just looking at clients who underwent C-section. So C-section birth, what is it? It's incision, it's delivery by incision through both the abdomen and through the uterus. That's where the incision is. It's done when a vaginal birth is considered risky to either the mother or the baby. So what do you mean risky? Well, it could be the fetal presentation. The fetus could be in a breech presentation or in a transverse presentation. It could be considered fetal distress that would trigger the need for a cesarean section. It could be placental problems. And two examples are placenta previa or placental abruption. Placenta previa is where the placenta is presented over the cervix, over the cervical os is what it's called. Or placental abruption is where the placenta is actually detaching prematurely from the uterine wall. Or it could mean that the labor is just not progressing. Some of these are planned C-sections. Some of these are considered emergency procedures. And if it's an uncomplicated cesarean delivery, the woman typically goes home within about 3 days. So when can you massage someone after a C-section? And actually, this is so interesting because this is true no matter if the client had a C-section or a hysterectomy or any kind of major surgery. When I say major surgery, I'm talking about that the client has been incubated and there is a cut into a major body cavity. Comparing with minor surgery, technically even dental extraction is considered minor surgery, or a biopsy or removal of skin lesions. All those are considered minor surgery. This is major surgery. And a client can receive a massage once they are considered medically stable. And again, if you are in a medical environment or a surgical suite, you definitely want to communicate with the patient care coordinator or the physician before you administer the massage, and you want to follow any directives that they give you. And of course, because we're talking about an incision, you'll want to use a sideline position to avoid putting pressure on unhealed wounds. the client may have a drain tube, and the breast of pregnant women and women who have recently given birth. They're engorged and tender, so a prone position would not be indicated after a C-section. Now, again, after major surgery, including a C-section, you want to avoid any kind of vigorous massage on the lower extremities. We are defining the lower extremities as the thighs and the legs for 12 weeks post-surgery. And you look at the studies at the bottom. The information at the bottom in parentheses is called a citation. And that's what we're going to be the research studies that has been cited to say that this is actually a new practice standard. And of course, you want to avoid massaging the scar itself until it is well healed and in the remodeling stage of healing. There's 4 main stages of wound healing. The 4th stage is scar maturation stage or remodeling stage. It has 2 different terms that I see in the literature. This time frame can be 8 weeks. It could be longer. So you have to really examine the scar, but massage therapy is specifically scar massage is excellent for incisions for scars once they're well healed. So it's something you do want to do when you're into this time frame, out of that time frame. Now, one study actually looked at pre-cesarean anxiety. And what they did was they had a reflexology group, they had a regular massage group, and they had a control group. So you had 3 different groups that they looked at. And what they found is that both massage and reflexology actually reduce anxiety, but the group that had the foot reflexology was slightly better. Both were good, but the reflexology group was slightly better at reducing pre-cesarean procedure anxiety. And again, still under the umbrella of C-sections, they did what's called sacral massage. So again, the client's in a sideline position, the pressure is being applied to the sacrum and a little bit on the lower back. And what they found was that it prevented urinary retention, this type of massage. And that urinary retention, according to the researchers, actually is a very common post-cesarean complication, the most common one, in fact. And the authors actually recommended that healthcare providers use sacral massage instead of urinary catheter insertion. So now we're going to be looking at the post-cesarean outcomes. And not surprising, after a cesarean, most patients did experience pain. But they also said that pain reduction is actually very important. We're going to find out all kinds of reasons why it's very, very important to not use pain medications as much in this particular stage. Now, most studies, and you can see a plethora, a ton of them at the bottom, a lot of citations here for the use of massage and reflexology and hand massage after a cesarean section. But most use these types of massage. And of course, it was done in a sideline position. But again, most were done, when I say immediately, we're still talking about that afterward when the client's medically stable. And then oftentimes there was a second procedure done, a massage procedure done either 60 or 90 minutes later. And these are some of the outcomes that they had found. Of course, pain reduction is number 1, a reduction of blood pressure in number 2, a reduction of respiration rates, and also heart rate variability. And this is something we're looking at a lot in all kinds of studies with massage therapy, is a reduction of, an improvement of heart rate variability. And that is a very good indicator of how well your nervous system is adapting to stress, basically. So why do we want to have less pain reduction with the opioid use and narcotic use after a cesarean section? And this is why. It's because postpartum women need to be alert to provide effective care and feeding of their newborns and to develop positive maternal infant bonds. So a lot of the conversation we'd be talking about tonight is going to be focusing on not only breastfeeding, but also, or just feeding, but also developing the bond, which is actually very important for outcomes of the baby later in life, as we're going to find out. So one study we're going to look at is massage as an adjunctive therapy in the management of post-cesarean pain and anxiety. And this is a randomized controlled trial. So what a randomized controlled trial is is that there were at least two groups, sometimes that there are three, like we saw in that study earlier with the flexology and the massage group. And they randomly assign them into the different groups. And it's considered one of the highest levels of research studies because it prevents bias. And this is why they're used is to prevent bias in the studies. And what they found was that handed foot massage and foot massage, both of these groups did help with pain, anxiety, blood pressure, respiration rates, and all of these decreased. The control group just received standard medical care. But what they found out too is that breastfeeding frequency also increased. And the researchers said why? It's because the pain was reduced, and that pain can actually, from the abdominal scar, can interfere with proper feeding of the baby, breastfeeding of the baby. So by getting rid of that pain associated with the scar, then they're more able to encourage breastfeeding. Now, this I thought was kind of interesting. This one used foot massage with and without orange essential oils. And what they found out was that both groups, compared to controls, decreased anxiety after a C-section. And they also looked at it 1 hour later, and they found out that anxiety was still reduced in both massage groups, with and without essential oil. But in the control group, anxiety actually increased. So this is something interesting to remember whenever you're thinking about using essential oils or not with your clients who have a C-section. But keep in mind that some hospital settings do not allow scents. So you have to be mindful of that whenever you're choosing to bring in certain products in a hospital setting. Now, this is one that I wanted to talk about, effects of connective tissue massage after cesarean birth. And now this would have very interesting preamble. Some people use the term preface instead of the word preamble. So their argument, I'm going to go back to this study, their argument is that most studies that looked at massage and C-section were done outside the United States, which is true. And that these studies did not account for the unintentional effects of individualized attention by the study staff. And this is something too, when you start looking at massage research, sometimes it's the massage and the attention that the client receives from the practitioner that has to be factored into the study results. They also said that they did not really spend enough time focusing on opioid use. And then going back to why this is important, because in the United States, not surprising, we consume 80% of the entire world's opioids in the United States. And I learned this whenever I was doing a class recently for Veterans Day for a group in North Carolina, that for veterans, that women veterans consume more opioids than men in the military. This is also true for cesarean section. They said that women aged 20 to 44 consume 30% more opioids compared with men, and that it's vital that we examine opioid use in women after cesarean sections, because it could be something that's perpetuated. So that's the preamble to this study. And this is what they did and what they found. So what they did was a back, neck, and shoulder massage. And they also did have, remember, they're trying to control for that individualized attention. So the second group had just individualized attention. And they did either 20-minute sessions of each, individualized attention, or the back, neck, and shoulder massage. And they had a control group of just standard medical care. And what they found out was that the massage group did have increased relaxation, decreased pain, decreased stress, and decreased opioid use on day 1 and day 2 of the hospital stay. Remember, going back to that previous slide, that women typically go home on day 3. So they just looked at the first 2 days. But what they found out is that in the group that just received standard medical care, that there was no change in opioid use. Because this is a group of massage therapists I'm talking to, we have to talk about deep tissue massage. Because oftentimes people say, oh, you can't do deep tissue massage on a pregnant woman or one who just delivered a baby? Well, actually, the answer is yes, you can. And I'm going to define what deep tissue massage is in just a second. And they gave a deep tissue massage twice, one 10 hours after the surgery and one 22 hours after the surgery for 15 minutes. And they did find that the deep tissue massage decreased pain and increased comfort levels in this population. So in massage therapy, there are two different levels of pain perception. One is called pain threshold, and one is called pain tolerance. Pain threshold is the beginning, the entrance into that painful experience. Like, oh my gosh, you're putting pressure on my muscles and I can really feel it. Now I can feel it. That's the threshold. The tolerance is at the end, the end. This is the minimum, this is the maximum level of pressure. And it is the maximum level of pressure that a client can feel as uncomfortable, and any more would be unbearable. So deep tissue massage is pressure delivered at a client's pressure pain tolerance, not threshold, but it's a tolerance. So it's their edge. This is the level that I like, and I cannot take any more. That's the definition of deep tissue massage. And yes, it's according to research, because we do have a lot of research that does study deep tissue massage. So they had to define it. So what this research is, now this is a meta-analysis of massage after surgeries, looking at just pain as the outcome measure, not just cesarean section, but also other kinds of surgery. And this is what they found. They found that massage is effective to reduce postoperative pain in the short term, which is immediate relief, and the long term, which is up to 6 weeks after the surgery. But look at this next bullet. Massage had better analgesic effects. Analgesic just means pain reducing or pain relieving effects on C-section and heart surgery compared to orthopedic surgery. And I love this next one too. They said the duration, whether it's 5 minutes or 20 minutes, or the dose, which means a single session or multiple sessions, did not greatly impact the results. And they also said the type of massage, whether it was foot reflexology or Swedish massage or even acupressure, did not impact results either. So, and again, we're talking about immediate short-term pain relief or long-term pain relief, that the duration of the session, the dose of the session, and the type of the session did not greatly impact results. There was no significant difference between all of these measures. Okay, now we're going to say goodbye to C-sections for a while, and then we're going to say hello to postpartum depression. The first thing we talk about is what it is, and PPD is the acronym. What postpartum depression is depression after childbirth. But look at this. If there's a 15% prevalence rate among postpartum women. And postpartum means after childbirth, by the way. It often begins 24 to 48 hours after birth, but it can also develop within 6 weeks. So there's a range here. And why we have to really be paying attention to it is because it's associated with adverse mother-infant outcomes and low-quality interactions, including lower breastfeeding initiation and duration. Now, this is called a position statement. So I do want to say that the American Pregnancy Massage Association does suggest massage for decreasing postpartum depression. So in general, before we start talking about the studies, this is what we're going to be talking about. So whatever the standard of care is for postpartum massage, postpartum period, we're going to apply those in the postpartum depression scenario. The overall effect of the massage should be relaxing and nurturing. So what does that mean? That means that even if a client comes in for, I have a headache, I have lower back pain, I have shoulder pain, I have neck pain, you're still going to address those outcomes, but you're going to start and end with that relaxing massage, that nurturing massage. And that typically means moderate pressure. Moderate pressure is defined between a 4 and a 7 on a 10-point pressure scale. And it also means slower speeds. about a 3 to a 5. If 0 was not moving and 10 was moving very fast, it's about a 3 or a 5 in terms of speed with that type of pressure. Now, and you're going to find out, according to the research, you do want to incorporate foot reflexology into the session. So if you haven't done reflexology in a while, you might want to brush those off your cobwebs of your brain and start using that more in your sessions with this population. And we're going to also find out that caregiver massage or partner delivered massage also had a positive effect on postpartum depression, as well as infant massage. And this is where we're going to segue these two topics together, especially if the co-parent was also depressed. Because sometimes we talk a lot about the female in this case, the woman in this case, but oftentimes there's a partner involved or a co-parent involved, and they may be also affected by the life change or by the pregnant client or the postpartum client who's also depressed. So we have to look at that variable as well. So this is the first study that we're going to look at. So they did foot reflexology once a day for 3 days. And what they found out was that it reduced anxiety, anxious behavior. Sometimes it's one of the things that they measure, because psychology is defined as the study of human behavior. So oftentimes studies look at those. It also had slower heart rates and reduced cortisol levels. It also reduced fatigue, stress, and depression. So even though we're talking about postpartum depression, sometimes anxiety is what's called a comorbidity. It happens at the same time. And if you know anything about mood disorders, you know that anxiety and depression are all often coexisting conditions. But again, most of the studies that I looked at and that exist in the medical literature do incorporate infant massage as part of the treatment. So here is the first study that we're going to look at. So mothers who gave their infants 15-minute massages twice a day for 6 consecutive weeks experienced significant reductions in postpartum depression. Here's another study we're going to look at. And this study had 2 groups. So they had one that had an infant massage class, and the other one just had a support group that dealt with depression. And they found out that both groups did experience reductions of depression, postpartum depression, but the class where they taught infant massage, they had the improved mother-child interactions. And I want to pause for just a second and talk about something I think is very important. I've been teaching massage at massage schools for over 35 years. And inevitably, you will have students ask you, okay, teacher, what was the 3 classes that were most impactful to your career in all the years that you've been doing massage therapy? And this is a question that you should be asking yourself and asking other therapists around you, because I think it's a very important question, because all of us, including a class like we're taking today, is basically part of your continuing education. In the UK, they call it professional development, continuous professional development. And for me, it is infant massage. That is one class that I took in the early 80s that has impacted my profession tremendously. Part of it was because you learned how to be a teacher. You're not massaging the baby. You're teaching parents how to massage the baby. But the second thing that I loved about taking the infant massage course is that you learned really how to track responses, because these are clients, if you want to call it that, individuals that don't have language. So you have to learn to really pay attention to nonverbal language and translate that into something that's actionable. So we learned a lot about nonverbal behaviors in the infant massage class. The second one, just to complete the conversation, the second class that had the most impact on me as a professional was Hakomi, Hakomi, and the third class was Traeger training. So those are the 3 that I tell my students that have impacted me the most: infant massage, Hakomi, and Traeger training. And I will talk a little bit about in a few minutes about places that you can go to get trained in infant massage, because I highly recommend it. if you want to work with this population. So here is another discussion about postnatal or postpartum depression. These are synonyms, by the way. So they had, again, two different groups, and this is similar to the previous study that we talked about. They had two different groups. They had the infant massage group, and they had the support group, which was the control group. And they found out that definitely, like we saw before, both groups experienced a reduction of depression. Only the infant massage group had improved mother-child interactions, but this study did one extra thing. They did a follow-up study 1 year later, and this is what they found, that the infant massage group of the original study continued to have better interactions with their infants 1 year later, 1 year post-intervention. So this speaks volumes to the importance of infant massage. Now we're going to talk a little bit about working with infants in NICU, because remember, what we're going to find out is that women who experience preterm labor may have preterm birth, and sometimes the hospitalization with the child in NICU, and NICU stands for Neonatal Intensive Care Unit, that they also may interfere with quality interactions between the mother and the child. So this one looked at depression and anxiety, those two different things, after their child was in the NICU. And what they did was, this is so fascinating to me. We call this vicarious touching in the second bullet. So either mothers massage their babies, or they actually watched other people massage their babies. And they did find that both groups, either massaging your baby or watching someone else massage your baby, did impact depression, but only the massage group had actually less anxiety. We talk about mothers massaging their babies, but what about the co-parent? What about the partner? What about if they massage the baby or doing it as a couple? Do you think that would have any impact on depression and anxiety? Yes. Now, I want you to notice, I'm going to talk about this study first, but then I want you to pay attention to this particular researcher, because this particular researcher came back later and wrote a paper about this study, and that started from their work with this particular research study. So what they did find was that couple-delivered infant massage decreased depression in both parents. And these parents actually complained about their baby less. So they felt much more connected to their babies. Now, here again, here's a lead researcher on that last study that I talked about. So what this is called is just a discussion about the topic that they did the study on. And so this study is called, or this not the study, this paper is called Skin-to-Skin Interactions, Does Infant Massage Improve Couple Functioning? And he found out the answer is yes. That couple-delivered infant massage helps establish a loving, nurturing parenthood between the two couples, between the couple, the two individuals. And he also said that it's a valuable tool, that infant massage is a valuable tool to prevent the onset of early negative outcomes for the baby. And then this one came out. This is a systematic review. So this is the highest level of study that's available to us. Typically, it's associated with what's called a meta-analysis. So they looked at the effectiveness of mother-led massage, infant massage, on symptoms of maternal postnatal depression. And what they found out that it naturally decreased postnatal depression. It also improved mother-infant interactions like we have seen before. But this one also looked at what's called self-efficacy. And that's the level of self-confidence that a person has toward what it is that they're doing. In this case, it's motherhood. And that they did find out that it increased, the infant massage increased maternal self-efficacy, and that all of these effects benefited the infants. And this is actually a screenshot of part of that study. And I really like talking about this because when you think about pregnancy massage, does it really have an effect on the unborn? And the answer is yes. So what you're looking at here is the dark blue is the maternal effects. The light blue is the fetal effects. So what we found out is, just looking at it from one side to the other, and for me, it's left to right, it increased IgA, and these are immunofactors for immunity. It reduces cortisol and noradrenaline. As you guys probably know, this is associated with stress. It also reduces leg pain, back pain, and improves sleep quality and sleep duration. It also has an increase on certain hormones, dopamine and serotonin. That last one we see in that second line, it's less anxiety, less depression during pregnancy and postpartum. So we think about this, massage during pregnancy actually reduces the likelihood of being depressed after you have the baby. And so what is the fetus or the infant going to be experiencing? A lower rate of prematurity, lower stress hormones in the fetus and the neonate, which is the newborn, a higher birth weight, and the neonates perform better on neurological and behavioral tests. So I just think this really is telling about all of the benefits that the mother and the baby and the unborn can experience by giving massage to the pregnant client. And I really like this one too. I want to look at the bottom first. So these two researchers, this study came out in 2021, they basically said community-based infant massage programs must be at the forefront of care planning. And they also said it's important to identify mothers of infants with depression and to provide support, and that training mothers how to perform infant massage plays an essential role in the mother's mental health and also reduce mothers' mood disorders. So I'm going to go ahead and just chat for just a second about my journey as an infant massage instructor. I was a mother of a single mother for 10 years before I got married and had more children. And I knew firsthand just how stressful single parenting can be. So again, I took the infant massage course early in my life, even as a new mother. My son was probably 2 years old when I took it. And I knew I had to get to mothers who needed that kind of support, who needed the infant massage classes. So what I did was I actually went to the health units where mothers go after to get their WIC vouchers or their food stamps, or to bring their child for their well baby visits. You need to go where the mothers are. And for me, what I did was I talked to the facility and said, just give me a room. Give me a room that I could set out, make it warm, dim the lights, and provide soft music, baby music, lullabies, and just invite their mothers to come sit with me. And I did it for free of charge. So for me, it was a volunteer service for many, many, many years. And even now, when I do an infant massage class, I don't charge for it. And I really recommend everyone having some kind of volunteerism that you select and that you donate your time at least once a month. One afternoon a month isn't a lot of time, to a population that is underserved. And this is definitely a population that's underserved. And I live in Louisiana, and right now in Louisiana, over 50% of the births are to women who are single. So again, there's a huge need for this kind of work in the community. So hopefully I'm tugging on some of your heartstrings, so you'll go get trained and provide this service to your communities. So this one looked at anxiety, again, not really depression, but anxiety. And what they found is that one 20-minute slow stroke back massage administers to mothers in the seated position. Now look at the next thing, using an odorless ointment, using the odorless lubricant. And why did they do that? They did that so not to hinder the development of the mother-child attachment. You want to have the focus to be on the touch and the mother's smell. So it's important, in this particular study, it was important to not use a scented lubricant. And I think Biotone has advanced therapy lotion, if I'm not mistaken. a lotion and a cream that can be used that is unscented. But again, so this might be something if you want to do this kind of work to be focusing on an unscented lubricant. And they did find out that it had a reduction on the mother's anxiety immediately after the massage, and the results maintained until the next morning. So they did one more measurement the next day. And since we're talking about infant massage, I love these studies so much. I do want to talk about infantile jaundice. So, now look, first of all, just feast your eyes on the bottom of this slide. We're talking about 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 studies. So a very robust finding that massage administered 15 to 20 minutes sessions, massage alone or combined with phototherapy, which is a very common therapy to reduce jaundice, administered 1 to 3 times daily, reduced bilirubin levels, and look at this last one, it increased defecation frequency. And this is one of the ways that the infant gets rid of bilirubin is through feces. So I thought this is a very powerful statement to not only talk about massage and its effects on depression and attachments with the family, but also that it can be done, infant massage can be done to reduce jaundice. This is not true for adult jaundice. It's a whole different animal. But for infantile jaundice, is indicated by numerous studies. And I do want to mention, just if you've ever taken the classes before or you plan to take it in the future, you do have to have your own baby doll. Oh, hang on a second. I just thought of something. So this is actually my baby doll that I use when I teach infant massage class. Yes, it's the same one that's in this picture. But one of the things that I was taught is that you want a baby with a soft belly. Do you see how this is? Some of the babies have a hard belly. Some of the baby dolls have a hard belly. But when you're showing how much pressure you're using on the abdomen, there's a whole colic routine, by the way, that can be done in infant massage, just specifically for things like colic. And again, it's really important that you have a baby doll that you can see that depression. So this has a cloth belly. And yes, my oldest daughter cut the baby's hair. So anyway, that's part of the reason why I like it so much, is because it's got my own children's fingerprints, all over my baby doll that I use for infant massage. So you can guess, this was got in the 80s. So it's been on the block a few times. Okay, so the last thing I want to talk about is I want to mention 3 places that you can go to receive infant massage training. I highly recommend taking it in person and not as an online course. This is the agency that I used when I took my course, and it is out of Albuquerque, New Mexico, but there are many others. Here is another one, Infant Massage USA, that you can take. And all these will be on the handout that you'll be receiving from Biotone either today or tomorrow. And the last one is International Loving Touch. So these are the three, and there's many others if you want to Google it, of the places that you can go to receive infant massage training. Yay. Okay, so in summary, what we've talked about today is how massage can be used to support women after they have cesarean births, couples and women who have experienced postpartum depression, and infant massage. So what I would like to do now, we have about 10 more minutes before we sign off. I'm going to stop sharing my screen. Goody. Now, I would love for you to either type in the chat box I call this the biggest takeaway. Something that you heard that I said, or maybe you read or thought about that was really impactful to you. Oh, while you're doing that, I do want to mention 2 things from conversations we had as we were signing people on at the top of the hour about manual lymphatic drainage. And the answer is you can do manual lymphatic drainage on this population. But keep in mind, this is not typically, not always, this is not lymphedema, this is edema. So you could do regular massage as well and still get positive results. It doesn't have to be MLD. And the next one was about IVF. Actually, we have a couple of studies, at least three, that have the use of abdominal massage and ear massage just prior to embryo transfer. And it actually increased not only pregnancy rates, but birth rates. So there is a positive correlation between IVF and massage. So absolutely. Well,
Susan,
this,
let me go through the chats
okay.
first, and then we can come back to, or maybe folks are already entering them in the chats, what struck them during the presentation. I wanted to start with the early on folks that jumped on. One question was, are there more miscarriages since COVID? Do you have information on that?
I do not. It's probably an easy Google. If somebody wants to Google that. Don't use AI, but because they're not always a reliable source. But that's a great question, and I don't know. I haven't really thought about it. Maybe by the end we can get an answer for that. Someone wants to be the daring one and take a stab at that
Okay.
using the internet.
And then Cecilia, would it be possible to touch on massage and IVF and IUI?
Yeah, yeah. Intrauterine inception. I don't. There's no studies about that in particular, but there are IVF, and we kind of talked about it. So abdominal massage and ear massage were actually studied and had positive correlations. I've actually done massages on clients right before and actually right after IVF. And what I did was, there's no study about it, is that I would do the regular massage, and at the end, the client flipped over, and I just kind of laid my hands over the abdomen, and I just kind of did a little blessing out loud, welcoming the babies to the world. Now she had triplets, just saying, but I just think it's a lovely thing to just incorporate that into your massage if you can. So again, there's no science behind it, but it was very meaningful to me and very meaningful to the clients that I've done it on.
Very good. And Janice is asking, what are some of the cues therapists should look for during infant massage to gauge effectiveness? An excellent presentation, excellent research. Thank you.
Oh, thank you, thank you. It's so fascinating. A lot of it is watching the baby's face. In fact, I have got a YouTube video on infant massage if you want to watch it. As I'm working on the baby's face, they start to grimace, and it was like, I'm not comfortable with this. So I immediately went to something else. So sometimes it's just the look of unhappiness on their face. One thing I love about infant massage is that you are taught, even before language, prior language, to ask the baby permission. So, like if you're looking at the baby, so Patty, would you like a massage today? I would love to give you a massage today. And I've seen babies as young as 2 months, if they do not want a massage, take your hand and actually push it away. That's a nonverbal cue. Sometimes it's the cry, and the cries are so interesting because the cry can be, I'm releasing tension, right? I'm not uncomfortable. I'm just releasing tension, kind of like an adult client would be, right? And sometimes it's I don't like this at all. Get away from me. And you just have to be a good auditory discerner. That's probably not a real word, but you have to learn to discern the sounds. And usually, if you think it sounds terrible, it's terrible. If you think it sounds good, it's good. But a good infant massage class will actually, you'll watch a video and you'll identify what these different expressions and sounds mean. But those are the few that I thought about. Is the grimace, the body language, and sometimes they'll actually scoot away from you. Oh, and another thing is, you never want to massage on a massage table. Obviously, you want to massage the baby on a floor with a mat, because the baby can get very active, and you can massage a baby like immediately as soon as they're born. You don't have to wait a certain time period. Now, if they're bottle fed, you want to wait about an hour but if they're breastfed, you can massage them immediately. So, and typically, like for my babies, I massage them after their bath because they don't have their clothes on. But my babies were massaged like a bunch. They got a daily massage, and I had twins. So I had a lot of help from my partner.
That's cute.
Great questions.
Cecilia is asking, I feel this would be beneficial for adoptive parents and possibly even foster parents to initiate bonding and possibly help with anxiety of having a new baby.
Absolutely. Yeah. And like I said, it's really good for the baby, but it's also good for the parents. So I think that's wonderful. In fact, that's a very understudied group. So that I'm going to put a little bug in your ear, maybe to consider doing maybe a case report on a foster parent or an adoptive parent with infant massage. I think that's a lovely idea.
And she also asks, I'm curious on effects of massage therapy on drug addicted babies in terms of withdrawal.
Wow. There is some studies on HIV, uh, babies born to HIV parents. And I did not bring that with me. I should have, but they are out there. If you message me, I'll drop my email into the chat. Or can you just provide my email when you?
Yes,
Okay.
Susan Salvo at hotmail.com.
Yes. Yes. Yes.
Um, for those of you that haven't attended an EduTalk previously, the day after the EduTalk, you'll receive a follow-up email. It will have a copy of the recording, a copy of the presenter handout, and the presenter contact information. Quite often, these go into junk or spam. So if you do not see a follow-up by midday tomorrow, please check junk or spam or reach out to me and I'll send you the follow-up again. But usually it's hopefully in your inbox. So if not, spam and junk. All right. Early intervention programs sometimes offer infant massage services for families.
Yes.
So, okay. Nicole, so wonderful. You support underserved populations and volunteer your time. And then, Nikki, can we see the training slide again,
Oh,
please?
absolutely. Okay. So let me go share screen. Bam. Share. I'm just going to do it like this in non-presentation mode. This is
Okay.
one that I have used. Again, I'm sure they're all good, but this is the one that I used, the Infant Massage, International Institute of Infant Massage. And this is the one actually started by Vimala McClure. Some of you guys may be familiar with her. She wrote the book called Infant Massage. She was the pioneer in it. This is the second one, which is Infant Massage USA. And the third one was International Loving Touch Foundation Incorporated.
And
So
I'll also include those in the follow-up as well. So you have that information if you didn't jot it down.
what I took was a 4-day class. The very last day, they actually invite parents into the classroom. And first part, you watch her teach an infant massage class. And then the second is she watches you teach an infant massage class. So it's a wonderful training that I hope that you guys consider taking. And again, volunteering your time to your communities.
Excellent idea. And Zoom user is asking, so much was impactful. I really enjoyed the first trimester update. My area is still behind. I get judgment. I do have a question for C-section. Does the position of the mother's arms cause an effect? Talking to a relative that's a surgical nurse explained arm position and the abdominal gas that can cause shoulder discomfort.
Ooh, I want to research that myself. Thank you for that. So arm position, I wish I would have looked at that. Where were you 2 hours ago? Just kidding. So I will check that. So arm position and gas, abdominal gas. Was that
Yes,
what I heard? Thank you.
yes. Explain arm position and the abdominal gas that can cause shoulder discomfort.
I'm gonna write that down too. I will check that out. I do know that for the infant massage, you do want to use the technique where you move down the belly and then you do put the legs into the abdomen and you do massage in the clockwise position, just like you would an adult, to help move the gas bubbles out for the infant massage. I know that's not quite the same thing as you're talking about, but I will definitely research that. Thank you.
Okay. And Joshua is asking, there was a study mentioned about C-section with three groups, control massage and just personal attention. What was the result of the just personal attention as compared to massage?
I think they also received, let me find that one, okay? I think they also received a reduction of depression. Let me do a search for it, attention. Hang on, that'd be faster. FATT. Dun, dun, dun. There you go. We're getting there. We're getting there. Next. Here we go. So what we have here is they did a back, neck, and shoulder massage, and then they had the individual attention group that both massage groups, I'm sorry, the massage group had the increased. It doesn't say, does it? Okay, well, here is the study. And again, this will also be in the handout that you get. So that would be a good thing to notice. I'm going to update my slide. You're sharp. If that was Joshua,
Yes,
very
yes.
sharp, Joshua. I will check that out because you're right on the slide. It doesn't talk about that specifically. So attention group. Okay, it looks like you give me some homework to do.
Uh-huh. All right. And then Nikki is asking, is baby's first massage no longer around? That is what I took 15 years ago. And then Claire Marie Miller. Claire Marie is still around.
Yeah, she's still around, but I don't know what year her book came out. I'm familiar with the book now that you said it. But I think it came out after Vimala. Vimala was like 1984, I think. Um, but I have seen Miller's book. But I think Vimala was first.
Okay. And that looks, oops, Joshua is back. What are the benefits or drawbacks of massage by grandparents for infants? I became a massage therapist after my children grew, but would it interfere with parent bonding if grandparents massage babies?
I'm gonna say no, it would not interfere. There was one study, I'm going to have to go back and look at this because I look at so much research where they talked about what was the benefits to the baby, and they did a foster grandparent group. Some communities have those foster grandparents, and they found out this is one of the first studies when they looked at what is the benefit on the giver of the massage, of the infant massage. And in this particular study, they said that it impacted positively the grandparent, the elderly person who gave the massage. So I think it would be a good thing to have, especially if that grandparent was part of the child's caregiver. This is why oftentimes you see the word not just the mom and the partner, but also the caregivers are also need to be participating in that infant massage giving to the baby. So I think it'd be very beneficial.
And Joshua is saying thank you. I don't see any other chats, Susan. Did you want to take this somewhere else with the audience?
No, I think it's perfect. I think this is a great place to stop. I mean, it's right at the top of the hour, and we've covered all the slides. There were some great questions. I've got some things to look up, which always makes me happy because I'm a curious person. And I love to see things through your eyes. So I'm gonna look this new information up.
Well, I'd also like to mention that Massage Therapy Foundation has a program called MassageNet, and they invite therapists to submit case studies and research based on your own practice. So that will be in the follow-up email tomorrow again as well. And
I will say, going back to what you just said, I'm on the committee that actually reads these case reports for the Massage Therapy Foundation. It's one of my favorite things to do. And if you ever want a mentor to help you write a case report, let me know because I've done my own research and I know how to put one together. And there is a formula to it, but it's good to have a mentor. There's a practitioner contest and a student contest. And if you write one that is an award winner, they're actually published in the medical literature.
oh, that's great. I didn't know that. Thank you for sharing that. Well, you've gotten many, many, many thank yous and great Zoom. So please, if you haven't watched Susan's March 4th, 2025, what we call the part one to tonight's EduTalk, please visit the EduTalk Archive Library on biotone.com. In the navigation bar, you'll see EduTalks, and when you drop down, there will be a link to the archive library, and you can just go back and look for the date of March 4th, 2025. Additionally, Susan has presented other EduTalks, which I'm sure you'd love to listen to. I don't remember the dates, so you're going to have to scroll through, but hopefully you'll find time over the holidays and be able to spend more time learning with the EduTalk Archive Library on biotone.com. Thank you so much. Are the recordings available? Yes, the recordings are available. Um, Again, you'll be emailed a recording of this tonight. I will include the March 4th recording link in the email. And I think that's I think that's it for the recordings. But I do want to um, get your sights on 2026. And the EduTalk series will begin again on January 13th.
Wow.
We'll start with Nathan Nordstrom, and his topic will be add tools to your practice for client satisfaction, self-care, and career sustainability. Additionally, we also have the EduTalk Diabetes series, which the archive library can also be found on the Biotone website under the EduTalk tab. January 20th, Linda Lockett Brown, our nutritionist and dietitian, will present on the mind diet, reduce your
Oh,
risk of dementia. And in August, an EduTalk Diabetes series by Jennifer Pressimone was on type 3 diabetes, dementia. So you might want to listen to the August EduTalk and then join us on January 20th for Linda's The Mind Diet.
yeah, I
And
too, I love the mind diet. I'm actually do a lot of it. In fact, I'm a big blueberry fan now after reading the research.
well, that's great. So we'll learn more together January 20th, but you've got a head start. And then January 27th, we have Michelle Plummer, and she will present on medical massage and post-op surgery benefits. So watch your inbox for invitations. Have a wonderful holiday season.
Yes,
And you've given Susan lots to get busy with. Susan, please share your results or your knowledge with us.
yes.
And we will see you all next year. Be safe, be well. Thank you for sharing so much with us, Susan. And to all, have a great holiday season. Thank you so much.
Keep learning, keep growing.
That's it. Thank you. Take care, everyone. Bye.